everyone, it's Laura from Peak Form Physical Therapy. I've got a couple exercises for you today. We're going to focus a couple of videos and blog posts about arthritis. So we're going to focus on osteoarthritis, which basically means the cartilage and some of the soft tissue surrounding a joint erode over time. It's sort of one of those wear and tear type conditions. Another gift of aging. So common places to see arthritis are the knees, the hips, the hands. So I've got a couple videos for you. Today we're going to focus on the knee. So when we're talking about arthritis, there's not much we can do for the joint itself. Once it's there, it's there. But it doesn't necessarily mean that you need a joint replacement right away. So what physical therapy can really help you with is building up the muscle strength that surrounds the joint so it can help offload a little bit so it doesn't hurt quite so much. If we can keep you moving and keep you functional, we can delay a joint replacement surgery for potentially a long time. So here's 3 things that you can get started on at home. They don't need any equipment for, but if you have specific questions or if these don't feel good for you, give us a call and we'll evaluate you personally and give you something a little bit more specific. So the first one I like to give people is called terminal knee extension. So what this looks like, it's a little hard to see, but what you're gonna do, you're gonna have a little bit of a bend in one knee here, and then you're gonna straighten it, squeeze those quadricep muscles and hold it for a good 5 seconds, and then you're gonna release. So the focus here is to move only your knee, not shifting backwards with your body, not shifting forwards and backwards. It's only the knee joint. You're gonna squeeze and then release, squeeze and then release. Rinse and repeat. So it's not a real difficult exercise for that one, so you can do a good number of repetitions, maybe 12 to 15 or more if it feels easy. The next exercise I like to give people is a curtsy lunge. So I like to give this one versus a regular lunge because I find it to be a little less irritating on the knee. So for this one, it's basically its namesake. So you take one leg, you bring the other leg behind you into a curtsy position, and then you lunge down from there. The trick here is to keep that front knee more or less straight, so you're not twisting everything as you lunge down. So keep one toe pointed forward, your knee is in line with that toe. The only thing that moves is the leg that's behind you. Bend both knees and then you drop down. You don't have to go down real far, maybe halfway, up and down, nice and slow and controlled. The slower you go, the better it is for you. Last little exercise is called a bridge. So you're going to be on your back here. And I want you to have your heels a little bit further away from your hips rather than real close. If your heels are further away, you can get your hamstrings a little bit more. So you're going to dig your heels into the ground. Think about really squeezing these glute muscles. Bring your hips up off the table. Hold for a few seconds and then bring yourself back down again. Same thing. Hold, 3, 4, 5, and bring yourself back down again. So the idea there is getting the other side of your knee. So with that first exercise, we're getting the quadriceps. Lunges, you're getting quadriceps. Bridges, you're getting your hamstrings and your glutes a little bit more. So like I said, you don't need any equipment for either of those, but if you need something more specific for your specific program, give us a call and we can prescribe something for you. We'll have more videos for you soon. Thanks, guys.